The human body is a sumptuous natural tool. Of course, our body does suffer from the occasional health issue from time to time, but it is well prepared to cope with all of them by giving us messages indicating what the issues are with our inside. And it is important to know what these signals look like and sound and to understand what they mean. If you try and think about it, what our bodies can do on their own is incredible. The organ's metabolism, temperature control, regeneration, and activity are all controlled without having to talk back and forth. But that doesn't necessarily mean that the body doesn't want to communicate with you. Like a car's warning signs, the body comes with a lot of indicators. You cannot know what they mean. Of course, here in How to Be, we'll never leave you salivating for more fun facts. Here's another episode of How to Be, which informs you about the 10 secrets that your body is trying to tell you. Sounds mysterious, right? If you're interested to be in the know, well, what are you waiting for? Sit back, hang tight, and grab your head, because it's going to burst later on due to fact overload. Number 1. Did you know that if you happen to have a metallic taste in your mouth, you could have renal impairment? A material called urea builds up in the bloodstream when the kidneys have not functioned properly for a long time, causing a disorder called uremia. A metallic taste is one of the main signs of uremia. If this is the only symptom, anything else would almost certainly cause it, but it may be kidney failure combined with a rise in urination and back pain. Number 2. Did you know that you may have a heart problem if you have diagonal creases on the earlobe? Look at their earlobes. Unless it has a wrinkle-like pattern downward, you may want to make some extra effort to improve your heart health. Some reports support a link between earlobe crease and coronary artery disease. An article published in the Medical Science Archives in 2015 states, these creases have been found by a variety of studies to be an indication that risks of coronary heart disease are rising. A research published in the British Medical Journal in 2016 found that those with folds on both ears are at higher risk than those with folds on only one ear. Number 3. Did you know that you're at high risk for diabetes if you have a lot of skin tags? Skin tags on the skin surface are small, benign outgrowths. Diabetes is a condition that causes elevated levels of excessive sugar in the blood. Which is the link? Researchers are still not certain, although certain research, like the significant 2007 article published in the International Journal of Dermatology, have found that individuals with multiple skin tags are at higher risk of developing type 2 diabetes. Number 4. Did you know that if you have pain in the jaw, you might have Lyme disease? Lyme disease is one of the diseases which is more difficult to diagnose. Yet, look after your jaw if you're afraid you might get it. When you suffer from the chronic pain that comes and goes, it can potentially be the source of this tick-borne illness. Your body may try to warn you that it is more serious, so be sure to specifically inquire about Lyme. As Laura Landro wrote in the Wall Street Journal, Lyme disease signs not only include headaches and body aches, but also joint problems such as the jaw. Number 5. Did you know that if you really like to chew ice, you might need lots of iron in your body? If you just like chugging an iced tea so you can get the ice cubes left at the bottom, a bottle of multivitamins can be time to reach. The body requires iron to help hold the oxygen in your brain and muscles, and people without iron have less oxygen in their blood. Scientists believe that ice chomping action activates a reaction in which the body pumps more blood to the brain, generating more feelings of alertness. If this sounds like you and you're an iron deficient, meat, poultry, and fish are the best options for having more iron. Number 6. Did you know that if you have a gray ring around your cornea, you need to take caution about your cholesterol levels? A gray or white arc is known as arcocinellus above the cornea, and if you have one, it might be a recommendation to cut down on unhealthy food. Arcocinellus is most common in adults due to the deposits of fat around the cornea tip. This may be the result of high cholesterol or high triglyceride levels in more severe cases, particularly when it occurs in younger people. Number 7. Did you know that if your nails turn white unexpectedly or any white lines appear on them, you may have kidney impairment? If your nails turn white unexpectedly or white lines develop on them, it may be a symptom of something serious, such as kidney or liver disease. Ridged nails can be a sign of kidney issues and form a spoon shape. Number 8. Did you know that you're at higher risk for heart impairment if you have some yellow lumps on your eyelids? Yellow bumps on your eyelids are called xanthelasma, and they are a valid cause to worry about your heart safety, according to the Harvard Heart Letter. In fact, these lumps are small cholesterol deposits similar to those in the blood vessels that cause blockages. People with xanthelasma are 40% more likely to develop heart disease and 51% more likely to die as a result of a heart attack. Number 9. Did you know that if your breath smells as sweet as candy, you could have diabetes? When your body doesn't produce enough insulin or doesn't function properly, which is what occurs with diabetic patients, chemicals called ketones begin to build up in your blood. Through your saliva, the body will try to get rid of them, causing the breath to smell sweet, or in some cases, like a remover from the nail polish. This is such a strong indication that a 2014 study published in the Journal of Breath Science found that breath smell is an accurate, non-invasive means of evaluating whether children have type 1 diabetes. Number 10. Did you know that if you have mass on your collarbone, you might have gastric cancer? A lymph node called Virchow node is situated near your spine above your collarbone, and oddly enough, it can serve as an alarm signal to your digestive system. When this node starts to swell up, a disorder called supraclavicular lymphadenopathy, it can be the first symptom of stomach, bowel, or colon cancer. Wow, have we just blown you away? That's a wrap for 10 secrets that your body is trying to tell you. Do you still crave for more fun facts? You better subscribe to our How to Be channel for more. Don't miss out on anything. Subscribe to How to Be now.